staffing shortages and emergency room closures and diversions as well are being caused by staff choosing to make more time for life than work. That's according to the interim CEO for Eastern Health, Ken Baird. He made the comments during the Health Authority's annual general meeting that took place late last week. Here's some of what he told the gathering at the Holiday Inn in St. John's.
Last year, if we were to have this conversation, we wouldn't have any idea about the issues that we've experienced this year with respect to staff resignations, staff choosing a work-life balance over, commitment to their job. We've seen pressures with our nursing resources who are choosing to go casual because they get better control over their work life. So that's new this year compared to previous years. So that's impacted our ongoing ability. So we're struggling with an ongoing pressure with staff resource. We've seen the same transition with physicians. So in terms of the specifics around the health sciences and the wait times, there are many factors that go into that. One of the factors is how efficiently we can get patients through the emergency department up to the inpatient floor if they're admitted. We're seeing pressures there. We're seeing different pressures today than we were seeing last year. So there is an ongoing effort around clinical efficiency. We've got a team that's completely focused on trying to improve the efficiency of patient flow in our system. However, that's impacted by the staffing issues which we've experienced this year. And so as staff choose to move away from full-time permanent positions because they're choosing a work-life consideration over their full-time commitment, because that gives them better control over the hours that they work. That's having an impact on the number of beds that we have available in the system. We're also seeing pressures in our long-term care facilities. These have been ongoing, but the efforts that we've been undertaking to work to recruit and retain staff in long-term care, with the impetus from staff making choices around work-life balance, that's a completely new phenomenon in healthcare. We didn't anticipate it, but we're seeing it, and we're having to deal with the sequelae of it. And so it's having an impact on our ability to maintain resource, to maintain beds. That is therefore backing up and causing us to have prolonged wait times in emerge.
And that is interim CEO of Eastern Health, Ken Baird, speaking at the Health Authority's AGM in St. John's last week with some developments that, as he's seeing it. Yvette Coffey is president of Registered Nurses Union, Newfoundland and Labrador. She joins the program now. Good morning.
Good morning.
And I thank you for joining us. So what is your reaction to those comments from the interim CEO at Eastern Health?
I share the sentiments of the registered nurses and other healthcare providers, nurse practitioners who work in these departments. They're frustrated, they're hurt, disrespected, and really, really upset. I was just listening to the preamble there and listening to CEO. There is no new phenomena. It's the deplorable working conditions that these people are working in that is forcing them to make a choice and to leave their permanent positions or to reduce their hours.
Ms. Coffey, the CEO emailed staff on Friday evening offering to meet with ER staff and explain his comments?
Yes, I emailed Mr. Baird on Friday. I had a telephone conversation with him on Saturday, and he did tell me that he would be offering to meet with the ER staff, and I do understand he sent out a corporate-wide apology email for the comments, saying they were taken out of context, and that was sent out on Friday. However, it's not much to ask that when you go to work that you're fully staffed, that there's beds available for these admitted patients, that you manage to get a break and be able to sit down and take a breather and have a bite to eat, and to know that you're getting off at the end of your shift. But that's not the case. And particularly, I have been involved with the Health Science Emergency Department for the past year and a half. And these are not new working conditions. They've just gotten increasingly worse. We've been trying to work with management, but their actions are way, way, way too slow. And we're at a point now where the emergency departments are the boiling point for healthcare. We have rural ERs who are on diversion. We have 130,000 residents in Newfoundland and Labrador without a primary healthcare provider. We also have long-term care, which is having staffing issues, acute care, rural, long-term, it's everywhere. We are in a nursing shortage, and to say that this was unexpected or not anticipated, we've been raising the alarm now for quite a number of years. The staff in these departments have been raising the alarms for almost 10 years, going back to my previous position when I worked at the Health Science and was the local president and was on a committee trying to address issues, and that's 15 years ago or more. And I just can't even imagine how these comments have made the staff who work in these untenable conditions feel, and my heart goes out to them. This is not a work-life balance issue. Work-life balance, everybody should have work-life balance. That's not much to ask. But our members have had enough, and they're saying enough is enough, and it's time to take action.
We're speaking with the president of Registered Nurses Union, Yvette Coffey. Health Minister Tom Osborne says he supports the heightened emphasis on work-life balance despite the negative impacts on some healthcare facilities. What are your thoughts on that statement?
Well, it's good to hear he supports our members having work-life balance, but that's not the reason we are in the mess we're in right now in healthcare. We have an aging population. We have people who haven't seen a primary healthcare provider, a physician or a nurse practitioner in over 2 years. We also have all of these people who don't have anybody as a healthcare provider. We've got people on wait lists for surgeries, for procedures. And if you're waitlisted and you have chronic healthcare conditions, they don't improve when you're not getting adequate and immediate healthcare needs addressed. By putting someone on medications for their diabetes that's newly diagnosed. Well, we've got a lot of people who have gotten sicker over the pandemic, with the wait times, with not having access to anybody to address their immediate needs. And I just think about where else can people go to? If you don't have a physician or a nurse practitioner and you have medications that need to be renewed, and we're telling people that if it's not an emergency, stay out of the emergency department, well, where else are these people going? Yes, they can try and call 811, but, for our elderly population, navigating a phone line system is very difficult. I know. I got family members myself who've tried to navigate it upon my direction. So we have a growing pressure in the emergency department. Long-term care patients, they not only are on inpatient units, at least 20% on a daily basis between Health Science and St. Clair's, they're also being held in the emergency department for weeks at a time. And I'm hearing horror stories from our members where these elderly people come in, they need placement in long-term care. Their families have done what they can do. And they've made that hard decision that we no longer can care for them. And they stay in the emergency department for upwards of 3 weeks. And some have even passed away in the emergency department. So you have these patients. On any given day, you have about 20 patients admitted between the Health Science and St. Clair's with no beds to put them in. And no beds means no staff to care for them in those beds. So the inpatient unit can say, we're full. That's it. They'll go in over capacity. You'll take 2 extra patients from the emergency department. But emergency departments, especially here in St. John's, who are the trauma center, neurosurgery, cardiac, all the specialties, they can't close their doors. And they can't say, we're only half staffed today, by the way, so we're closing half of our emergency unit. That's not the way it works. So the pressure is building. It has been building for quite some time. There is nothing here that's new. There's nothing here that was unanticipated. And yes, we argue that registered nurses, nurse practitioners should have a work-life balance, but they need to be able to go to work in conditions that are conducive to caring for our patients. And right now, the deplorable conditions they're working in is not conducive to their mental or physical health. And all of that equates to poorer patient outcomes.
Yvette Coffey, President of the Registered Nurses Union of Newfoundland and Labrador, I thank you so much for joining us this morning and getting your reaction to these comments.
Thank you.
There you go. That is Yvette Coffey joining us, and stay with us.